Thank you very much. Dr. Anthony Fauci, we just saw there with this warning about the Omicron variant.
It is the most transmissible virus of COVID that we had to deal with thus far. When you look at the pace of the infections now, that things will get worse as we go into the depth of the winter. And with Omicron breathing down our back, things could get really bad, particularly for the unvaccinated.
The CDC is projecting 1.3 million new cases by Christmas. That's just next weekend. And more than 15,000 people are expected to pass away from COVID per week by January 8th. Dr. Marc Siegel is in focus now, Fox News contributor, professor at NYU Langone Medical Center. So, Dr. Siegel, you always present more than one side of the story, and there always is one. So it's really catchy. Omicron, we get it. How dangerous is it?
Well, let's start, and thanks for the compliment, Harris. You do the same thing. Let's start with the fact that the fear messaging is not working. If there's anything Americans are tired of, it's the constant fear messaging. And it's also single note, right? It's mask, it's vaccine, it's testing. Well, we don't have the testing. We don't have the rapid testing we need. I find testing very comforting because if you had a rapid test in your home, you could tell if you were exposed or if you had it. We don't have that. But the masking getting mixed up with vaccines when vaccines are much more effective is also that single note of fear. Now, what is the reality regarding Omicron? What is the reality? Well, we're getting a lot of data out of South Africa and the United Kingdom now that shows that this is milder. This appears to be a lot milder. That's good news. But the other issue is that it's affecting mostly people who are already infected or had the vaccine already. So the number of hospitalizations in South Africa was 10 times greater for Delta than for this. So it seems to spread much more easily, and it seems so far to be milder. That doesn't mean it's a cold. It means it's more like a severe flu so far.
So let me get this straight. So people who've already had it and people who are unvaxxed, is that what I heard you say, are more likely to succumb to Omicron? You said people who've already been infected. What does that mean?
I'm glad you. Let's clarify that. If you've had Omicron, if you've had a previous variant, or you've had the vaccine and are not boosted, you can get a reinfection. This variant breaks through the vaccine and it breaks through prior variants. If you've been boosted, the chances are a lot less than you're going to get it. If you've been boosted or had a prior variant, the chances are you're going to get a very mild case. That's the key. If you've had neither the vaccine nor the booster nor a prior variant, that's when you're at risk for a moderate case.
All right, I want to clear something else up, and thank you. What are we to know about all of these mask mandates and how they figure in? The one thing that you have taught us consecutively over the last now 2 years of dealing with this nearly is that it is grouping and large groups of people unmasked because you don't know what everybody's status is in the room. And I don't mean vaccinated, unvaccinated. I mean positive, negative. And that's where we tend to get into trouble. So what are we going to do this holiday season when people are grouping together?
Well, you just simplified it, and I think William Schaffner, who's a friend of mine on CNN, completely mixed this up. I think you just gave the right answer. If you're going into a very large place, and there may be a number of people there who could be super spreaders, that's when you wear a mask. If you're going into a home where you know everybody's vaccinated or there's no risk or little risk, you're going to ruin your whole holiday gathering with a mask. Don't need to do that. Masks are for large public places where you don't know.
Why won't the White House tell us that? Because that's so basic.
Well, they should listen to us. I bet they watch us. Maybe we can help.
Okay. All right, let's move to this. The CDC is reporting startling new nationwide COVID numbers with cases up nearly 40% from just last week. Some of this we anticipated, Doctor, because people are inside now. It's been nice in New York. It's about to get cold, forecast. So the more we group indoors again, are we going down a road, though, where it's going to get even more?
Yes, we are, and that's the second time you said that really important point that no one else is saying, Harris. It has to do with the idea that it's a respiratory virus, and if you're indoors, that's when it spreads the most. We tend to forget that because with this pandemic, it's been spreading anyway. The reason it's going to get more is because Omicron is so wildly infectious, and it's a lot like measles in that regard. But a lot of us feel that it's going to crowd out Delta, and we're going to have milder infections. That doesn't mean it's over with. But again, if you got vaccinated, if you had a test, if you get a milder case, and finally, most importantly, if that pill ever gets approved by the FDA, I could say, uh-oh, you have Omicron, let me give you the pill, bang, and you feel better.
Well, look, you said the same thing about Tamiflu, and that's been a game changer. For flu.
You know, Tamiflu was a big game changer for the 2009 swine flu that I wrote about. Yeah. This is the game changer here. Paxlovid, the Pfizer pill, looks tremendous at keeping people away from severe illness if you diagnose this early. Let's get it approved. It's before the FDA right now. They should approve it right away.
Wow, you gave us some things to hang our hope on there that we're not hearing, and one of them is Omicron could actually crowd out Delta. Not making it, you know, a hero of any sorts, but Delta is definitely, as far as we know right now, a lot more deadly. And those are the details that people really need to know. Those who are on the fence about getting vaccinated, those who are going to maybe say, I'm not going to go to that big crowd this weekend because I don't really know who's there. It helps people make their own decisions. Dr. Siegel, thank you very much.
Always great. Thank you, Harris.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.